Thank you so much, everyone. Thank you, Jejide. And this is the opportunity where we want to let the audience jump in and ask any questions. Feel free to type your questions in the chat box.
And this is set up as a Zoom meeting, so you can also ask your question as well.
I have a question. As a younger individual who is generally healthy, but has parents and grandparents, what should I be concerned with? As people begin to return to normal, and masks aren't as required in different areas. I know Uber's just took it down, but I want to keep my loved ones safe. What should I be concerned with? To achieve that goal of keeping my loved ones safe?
Yeah, that's a fantastic question, and it's something that we're all concerned about. And the problem is you can't control the people around you, and so you're right. Now that masks are down, we're more likely to be exposed to people with COVID. So the first thing is to make sure your parents are vaccinated, and they would probably, based on their age, qualify for the 3 doses plus the 4th booster, the second booster, a total of 4 shots. So make sure they're vaccinated. When you go and visit them, one thing you could consider is getting a home PCR test, those antigen tests, and you could test yourself before you go over and make sure you're negative. It's a 15-minute test. And that would be another level of protection. So if they're vaccinated and then you test yourself before you go over, then you've done about everything you can do.
Okay, thanks. And just one follow-up to that. I don't have the box in front of me, but I when the Postal Service was offering to ship them out, I got those tests. Is that one of the ones you're referring to?
Exactly. Yep. You can use those, and then they also sell them at pharmacies.
Okay, great. Thank you.
And as a pitch, if you live in DC, you could get 2 boxes for testing kits pretty much every single day, along with PCRs that can go into a kiosk. That the turnaround is about 24 hours right now, if you're a DC resident. So please take advantage of what we have.
Sounds good. Thanks for all the information.
Thanks so much for your question. I have a question if no one else is asking anything right now. How effective or how good are the at-home tests in identifying the new variant or the new Omicron subvariant?
They're as good as detecting the other ones. The at-home tests are something called antigen tests, and they're not as good as the PCR tests that Dr. Fishbein mentioned. The problem with the PCR test is there's a longer turnaround time. It takes about 24 hours. So it's not as convenient. But the antigen test, it's quicker, it's at home, it's not quite as good, but it's pretty good.
Thank you so much.
There's a question in the chat. Yes,
Sorry, I think my audio cut out for a moment. I have a question here that says, I've been wearing my N95 at work, even though most are not. My point of view is to be more protected rather than taking a chance, since in Virginia numbers are rising. Do you think my logic is correct? And that is from Amy Altman.
Yes, I mean, I wear a mask all day at work every day. And that's something you can do. It's like wearing a seatbelt. You wear your seatbelt to protect yourself. So wearing a mask to protect yourself makes perfect sense. And, a lot of this is individual level of risk. But the only way you can really protect yourself is getting vaccinated and then wearing a mask.
Thank you, Amy.
I have a question, Dr. Wortmann, not to put you on the spot, but I get this a lot from people about children under 5. So, and the data keeps changing. And, and some data now came out and some didn't come out. So people were saying, when can they expect to see some vaccines available for children under the age of 5? Do you have any information on that?
No, I don't have any special
Yeah.
insight into what's going to happen. I think it'll come, eventually they'll vaccinate children just like they do for flu.
Yeah.
But not there yet.
Yeah, I didn't want to put you on the spot because I know you're presenting what's approved. It's I just get the question all the time.
Yep.
I had a quick question as well, Dr. Wortmann. So the Omicron variant now, that's considered the BA, are they calling it BA1?
We're still in BA2, although that's the primary. Every day there's like little variants that are coming up.
Right. So I've seen some things about that, and I'm wondering if it's different enough to be any more contagious or infectious.
Yeah, there were. I saw those reports about the next subvariant that's coming out, and we don't know. And even within countries, there's sometimes this variant takes off in England, but then it won't take off in Germany, and then in India one will take off, and then not somewhere else. So it's not uniform. We really don't have a great understanding of why some countries have some variants and others don't. A lot to be learned still.
Right. Thank you.
I see that Dr. Khan also answered. So I do encourage, if anyone has questions on any of the studies that were presented, Dr. Khan, we briefly presented on your study. Is there anything else that you wanted to add? I don't think you had heard.
No, that's fine. Sorry about that. I was late. But yes, no, I think, the encouraging thing about the whole thing is that, and I'm sure Dr. Wortmann's slides tell you that very clearly, is that people who really get sick, that's where we've got a good handle on things. And that's the most important part, people dying, getting mild illnesses, when, we do that all the time anyway, of course. So, and our study is part of that. It's part of the future where we're going to be focusing on inflammation, which is what really makes people sick, rather than, let's say, coronavirus, which we've kind of known for a long time. So, that's really what I wanted to sort of say from my study standpoint. Hopefully, we're going to get some results in the next couple of 3 months. So we're very excited about that.
Great, thank you so much.
We still have quite a few minutes left, but for the sake of moving on, I'm going to go ahead and present on these following slides. But if anyone has a question, we still have a few minutes at the end.